In the previous video, I spoke about using a little bit of salt at the back of the tongue to reduce the gag reflex. Now, what if that doesn't work and now while you're working on the patient starts to gag? Well, these are the exercises which you need to go through to distract your patient effectively so that they don't focus on what's in their mouth and the gagging, and instead you're redirecting them into doing something else. And this is how you go through those exercises. So just for demonstration purposes, my patient here is going to fake gag for us, and I'm going to walk you through all of those exercises you need to do to help get some relief while you complete your impression. So I'm going to now move this and place the impression tray in the patient's mouth, and you can see that he starts to gag. So while the tray is still in the patient's mouth and they're still gagging, you're going to speak very authoritatively to your patient. Sir, I want you to raise your right foot, point it forward, and go in a clockwise direction slowly. And you're going to count with them. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Bring this foot down, left foot up, pointed forward. Always keep your eye on your toes. Do not close your eyes. Go in the anti-clockwise direction for 10 counts. And you must count along with them. Now, this foot down, both feet up. Hold, point forward, look at the tip of your toes, 10 seconds. Count that 10 exactly in the speed which I counted it at, and back down again. Let's do the 2 feet up again, and point it forward, and look at the tip of your toes. Keep your eyes open, again down, and now let's go back to the right foot, and clockwise again, and then go anti-clockwise, 10 seconds, 10 seconds. Essentially what we're doing here is we're giving the patient something else to think about, something else to focus on. The speed of your voice, the tone of your voice, the count which you do, all of that is giving them something different to focus on. And that is very important because we don't want them thinking about that impression material in the mouth which is going to take 5 minutes to set. So do it like a regular pattern so that they understand what needs to be done. And I'm sure you're going to get a successful impression. I hope I've confused you enough, and I hope that you don't have a problem with gagging the next time you see a patient. There is still one more trick up my sleeve, and this is something we'll talk about in the next video. Till the next time we meet, this is the Dental Review Guy signing off with a smile.